Hi guys, I'm with Dr. Josh Livingston, and we want to talk about how hormones affect especially men's health. So doctor, why don't you kick us off? We had a lot of feedback about hormones and specifically men's health.
Sure.
Explain to us how testosterone and estrogen work in the male body.
Well, we know that testosterone is the main sex hormone in men, and it results in the secondary sex characteristics that we have. So increased muscle, increased hair, all of those things that we go through puberty on. But what we're seeing now is that much of that is delayed. We're seeing that later in life, and we're seeing it not to the same degree that we saw even 20 to 30 years ago. We're exposed to many things that we weren't then in the way of our foods, our plastics, the things we drink and eat. Everything that we're exposed to now is just different than it was in the past. So we're seeing a lot of diminished hormone levels in the way of testosterone and elevated levels of estrogen. And what we result from that is, it doesn't have anything to do with sexual preference or anything else, but it does have to do with overall human development, muscle mass development. It can lead to depression, fatigue, decreased libido, erectile dysfunction, many different things that we're seeing at levels that just weren't recognized up until basically now.
Wow. And how do opiates and narcotics affect that drop in testosterone?
Right, absolutely. So there's many different medications that we prescribe commonly, from cholesterol medicines, diabetes medicines, as well as opiates, pain medicine, that destroy production and effect of testosterone. And not only while you're on them, but for some time after. So even something like a 30-day prescription after a surgery or something like that can affect testosterone for 4 to 6 months after in the way of diminished levels. And that can result in delayed healing, increased pain, worsening inflammation, delayed recovery, and then motivation just to keep it moving again. They want you to go physical therapy 2 or 3 times a week. Well, I don't want to go. So you don't show up, you don't get better. And something that just isn't really discussed, and especially as it relates to surgery and major surgeries, knee, hip, back, is that that will alone diminish testosterone. Replacing it will again improve in speed recovery, decrease pain.
Wow, so many young male athletes out there, you guys, who have had major joint replacements or torn their ACL, or had a shoulder tear, or thrown their back out playing sports, and maybe they have had injuries and they've been put on narcotics or other things, steroids, to help them recover. And these are things that will affect them even in the long-term stages of their development by having a lacking testosterone, even in a fundamental time of their life between the ages of 18 and 25, when most men are really supposed to be peaking their adulthood.
Absolutely.
Is that correct?
Absolutely. Yeah.
And here they are coming with a crash because they've blown their shoulder out playing football, or they've, shattered their knee, doing whatever, martial arts or something. So we wanted to touch on that so that if you are a young gentleman and you are looking into fitness and health as being your ultimate career, you have an idea of some things that you might want to check. And food is something else that is very clear insofar as estrogen being supplemented into our plastics and things like that. So being mindful of that, and if you're an older male and maybe having some of these symptoms that the doctor is talking about, we want to go over some of those things so that you're also consciously aware and can make those healthy choices for yourself as you age. And so let's talk about how estrogen in the food affects the male body, and what are those in, doctor?
Right, well, so there's many different types of food that contain estrogens. Soy-based products, a lot of people relying on soy milk, soy proteins, soy even supplements for their protein, which contain pretty high levels of estrogen. And when we get an imbalance of testosterone to estrogen, since our levels of testosterone typically are not as high as they were in the past, getting a little bit of elevation in estrogen, we're out of whack. What we want to see naturally or normally is about a 3 to 5% total estrogen level to testosterone. But what we see commonly by the time we get labs in patients who see us, it's not uncommon to see 10 or 15% total, the total of testosterone to estrogen ratio, which is really, it's just not physiologic and it's very damaging. So they'll result in fatigue. That's where you get sort of that dad bod look, where the muscles are gone, the body fat's increased, gynecomastia or man boobs, libido's gone, motivation's gone, energy's gone, you just feel wiped out. And that's how it relates to depression, and we've talked about that, how it's very common for patients to go into their primary doctor, they get their 7 to 10 minute visit, they get 4 symptoms that they complain about. Obviously the doctor's already got it nailed, it's depression every time. Start them on medicines for depression and they get worse. And sadly, in the young adults, we watch the commercials, suicidality even increases when they're put on that medicine. Well, most likely, they didn't even screen for low testosterone because they don't figure that 21, 25-year-old kid has any problem. Man, we're seeing it though, very commonly. And by the time they get to us, the levels are often even below normal for a man in 60, 70 years old.
Wow, I know you said even on like the ED commercials, there's no age
Not anymore.
limit anymore, because if the kids are put on these narcotics, they would have these symptoms, which would only make their depression worse.
Right,
Is
of
that
course,
correct?
right.
And then of course, as they lose weight or they lose muscle mass, they feel bad about their self-image, their confidence gets hurt, and they can lead and spiral down into more addiction.
Absolutely. So unfortunately, what we're seeing, whether it be what we call iatrogenic addiction, meaning they came in, they saw me or another physician after their surgery or for their chronic pain, we prescribed them medicine, they started on it by prescription, often that escalates, and unfortunately pretty rapidly at times, to where they're no longer taking it as prescribed and are abusing and addicted. But then there are people, it's a tough time right now. I've heard 12, 13-year-old kids, go and find opiates in mom or grandma's, medicine cabinet, start taking them at that age.
Wow.
So it's not that it's an older person, it can be anyone, and it does it to all ages. So you start those medicines when you're a 12, 13, 14-year-old boy. By the time you're 16, 17 on heroin, your level of testosterone has never gotten to anything. So your development and your desire and your brain is just not going to be what it would be with a natural or an optimized testosterone level. It's completely different.
So let's talk about older gentlemen then, because I'm assuming it's never too late to start testosterone.
No,
am I correct?
Absolutely not.
And so let's say I'm a gentleman in my 50s, 60s, and I'm feeling tired and I don't want to go to the gym, and I'm in a labor-intensive job, and this is getting really hard, and I can feel my knees and my... What does testosterone do for me? How can I get ahead of the aging process?
So there's anti-aging medicine is a specialty in of itself, and it is looking at hormone optimization at any age, right? So one of the things that's really unique about testosterone that isn't discussed much is its effect on memory and even dementia risks, as well as dementia symptoms in someone who's already developed them. So you could put a patient in 70, 80 years old who has mild to moderate dementia on testosterone, and their memory will get better. It's something that is not even discussed because they want to put you on 3 or 4 pharmaceuticals, and you need hormones, which will also help maintain your muscle mass, your bone density, decrease body fat, decrease stroke and heart attack risk. The benefits are just so many because it is a natural hormone that supplies our entire body. It's not a medicine that goes to one area or treats one symptom. So it's really something that's affordable, physiologic, and just amazingly beneficial for long-term health.
That's great. Thank you so much for your time today, Dr. Livingston. You guys, if you have any questions, be sure to follow us on Instagram and subscribe to our channel here on YouTube. We're also on Facebook at Restorative Health. So look us up if you are interested in talking to the doctor about things that are more specific to you. Either way, be blessed and well, and we'll see you soon. Bye-bye.